Dr. Amrita, remain on the dais, please. So there is one question for you. What about the technicalities? There are so many technicalities that you have said, and you are the one of the best experts in North India as far as the pump is concerned. But what, people, our friends who are clinicians here, they want to ask very simple person, whom to give this pump to? Which person? Type 1, type 2, what is the age, what is the education? Simple.
Sir, I will like to answer from my experience. We have an experience of more than 300 patients on pump, and we have ranging from 7 years to 70 years, both type 1 and type 2. But if I say most of the patients with type 1 are willing for it, those type 2 patients who are on dialysis, post-renal dialysis, then advanced liver disease, very high dosage of insulin, we almost like 200 units of insulin, those people are ideal candidate. But all the patients, we generally give patients more than 6 years old for the ease of handling of pump to be on the pump.
Thank you. Dr. Amrita, one more question. Once again, what is the age that you will prescribe insulin pump? In what type 1 patient, what is the age? 2 years age, 5 years age, 10 years, 12 years? What would be the age?
So for type 1, basically, the patients will not be able to handle the pump if they are very small. So they will definitely require an assistance from the parent. But what we follow is like 6 years of age, 6 years above can be put on pump. There's a option of remote control also. And the pump can be safe and child locked so that there's no extra boluses happening to the patients. So 6 years, if patients are willing to intervene, and if patients are not capable to intervene, if parents are not capable to intervene, then I would suggest somewhere around 9 years plus.
Dr. Israni, that answers your question. Okay. There is one question for Dr. Anuja, and that comes from two very distinguished people who have joined us here. Dr. Israni, Dr. Kalra. There are many distinguished people who have joined us. Thank you all for coming. Question is about the camel milk. You said about milk.
Yeah.
There has been a lot of controversy and people have been selling camel milk as a panacea for diabetes. So what is your view?
Sir, actually, although I said the property of camel milk is A2 type and which is beneficial, but there had been some studies from ICMR and some other agencies, but they were inconclusive. And also because they found that camel milk has to be actually taken fresh. The shelf life is very, very short. And also it is very bad in taste. So one has to get used to this taste. And also then they also saw whether it can be powdered and all. This is actually going to be a very expensive proposition. So I think at the moment there is no scope of getting camel milk, although people are just selling it on the thing that, okay, it will control diabetes or will not prevent diabetes. But at the moment, the results are inconclusive.
Thank you. Anuja, please remain with us because we'll ask more questions. Questions are coming and we'll ask as and when we have more time. The lectures are on tight schedule, but we will certainly have interaction.
So the fiber content and the moisture content is different that we found, and that is why that could be one of the reasons that why there are different results in different varieties of mango.
Mango contains a DPP4-like substance known as lupiol. Is it different in different varieties? Maybe the different glycemic effect.
Has not been tested too much on as far as that is concerned. And the fiber, moisture content all vary between different. In fact, when we submitted this proposal to ICMR, they immediately accepted. They said that nothing has been done in this regard. But what they wanted was 3 varieties at least, 3 varieties of them. And so we could test only 3 varieties. There are many more varieties to be tested. For example, Chausa is a very big mango and very sweet one too. So those kind of things are needed. But this at least establishes 3 varieties that in a short term, 1 mango, no problems as far as your glycemia is concerned. But maybe next conference, We'll present more data of 2-month study. We'll present more data on the continuous glucose monitoring data. Area under the curve, very scientifically done, very scientifically. So no more this thing कि आप खा लीजिए, आप नहीं खाइए, आप 4 खाइए, आप 2 खाइए, आधा खाइए, मत खाइए. That kind of thing is gone. With this study, I think we'll silence all that and we'll present absolutely correct picture. So preliminary data is here. We'll present you more. Thank you, Sugandha.